welcome to this special edition of the Research Sofa. I'm here today with Dr. Emily Shoesmith, who's a research associate at the University of York, and we're going to talk about her work on human-animal interactions. So welcome to the Research Sofa, Emily. It's great to have you on the show.
Thank you, Emily.
And could you just tell us a little bit about the work that you've been doing on human-animal interactions, please?
Of course. So since the beginning of the COVID-19 pandemic, research has emerged investigating human-animal relationships and the interactions in the context of the pandemic-related social restrictions and the links with mental health. So we have been conducting surveys in both the general population and with people with severe mental illness to investigate the role of companion animal ownership, the links that it might have with mental health and physical health, and also the perceptions of the human-animal interaction and the relationship that the owners have with their animal.
And so what did you find in the results or in this research?
So with the survey that we conducted with the participants with severe mental illness, it was conducted with a previously assembled cohort of individuals with severe mental illness in the UK. The survey did include items measuring outcomes related to mental and physical health and human-animal interaction, but we also invited free text responses. So of the 249 participants who completed the survey, just under half of these had at least one companion animal, and we found that animal ownership was not significantly associated with well-being and loneliness, but animal ownership was associated with self-reported decline in mental health, but not physical health. So this is actually quite an interesting finding, given that companion animals are assumed to be beneficial for mental health for most owners. And in fact, in the general population survey that we conducted, we found that a companion animal was associated with smaller decreases in mental health. So it's possible that animal owners with severe mental illness reported a decline in mental health due to the pandemic restrictions and subsequent challenges of animal ownership that may be amplified during this context. But it's also important to note that we collected qualitative data as well, and this really did highlight the benefit of animal ownership. So maybe the discrepancy identified between the qualitative and quantitative findings highlights the complexity of the relationship between the owner and the animal.
Yeah, so it sounds like it's quite a complex thing and not easily determined in a survey as to exactly what's going on.
Absolutely. We would really like to draw out more additional qualitative data with people with severe mental illness, because we weren't able to conduct interviews with them at this time. It was just a free optional question at the end of the survey. So if we conduct further qualitative research to unravel the elements maybe contributing to the complex relationship, I think it would facilitate our understanding more.
Yeah, so is that the further work that you think needs to be done now, based on the findings that you've got so far?
Yes, absolutely. I think if we're able to facilitate our understanding of the more specific needs of animal owners with severe mental illness, maybe, and we can target or develop further support strategies for people with mental illness who have companion animals. And in terms of further research as well, we didn't ask about the strength of the bond with the companion animal, which is also an important construct that may be connected to mental health vulnerability in companion animal owners. So we did find in the general population in the previous survey that we conducted that a stronger bond was significantly associated with mental health scores. So further explanation of this is warranted, and it would be useful to ask animal owners with severe mental illness about the perceived strength of the bond to maybe help identify mental health vulnerabilities.
It's really fascinating, all this information you've gathered. So what do you think the importance of this is?
So I think the importance of exploring the human-animal relationship in both severe mental illness and the general population is really important, because it's often assumed that companion animals have such a significant benefit for mental health, and it's a really complex relationship that we need to explore further, so that people do not think that it is a rush decision to go and spontaneously adopt or purchase an animal in order to try and promote or enhance mental health, when there are so many complex elements contributing to the relationship with both positive and negative aspects. For example, we did find that there were COVID-specific animal ownership concerns, such as restricted access to veterinary care, potential development of separation-related problems, with the animal. So there are a lot of negative elements associated with ownership as well. And it's not just the benefits that we need to focus on, because we do need to consider animal welfare as well. So this decision to purchase or adopt an animal to try and enhance mental health doesn't result in subsequent relinquishment or the animal being cared for adequately.
Yes, that sounds really important, that people don't go into a rash decision and adopt an animal, or be encouraged to adopt an animal when that might not be the best thing for that particular person.
Absolutely.
Yeah, so, well, thank you so much for coming and talking to us on the research sofa today. This, it's a really different topic that we've discussed on the sofa before, so really happy to have you. And thanks for joining us.
Thank you for having me.